Good morning, everybody, and or good evening, good afternoon, depending on when you're listening to this. Obviously, most of you are accessing this as a recording. So what I wanted to do, first of all, before we start on the ethics session that we've got planned for this morning, is I just wanted to do a little bit of housekeeping and a little bit of a discussion about what happened yesterday for those of you who were with us, and also some important information to pinpoint if you weren't with us yesterday for the workshop. So if we go to the module site with the penguins, you will notice that there is some new activity under the Writing Your Project Proposal tab. So if we click that, you'll notice that I've put resources from the workshop. If you open that tab, there are a number of resources that have been highlighted that I've shared with you from yesterday. So the two module records, which is the second document down there, APP 703, which is this module, and SPP 701. I know we highlighted that on day one when we talked about the two modules, but there are the two module records just for your information. There's also the session on action research that we went through in the morning, a very informative session, but those of you who were with us, you will note that there was quite a lot of discussion, there was quite a lot of input about some of the slides, which if those of you who weren't able to join us yesterday want to ask any questions about any of this material, please don't hesitate to contact me or email me. But there's the action research presentation from the morning, there's the project management and service improvement PowerPoint, which was a really important PowerPoint highlighting sort of the project management service improvement sign, very much taking you to the SPP module, which starts in November. There were also some Word documents that Kim provided for us that will help you with your management, and also that PDF, which is probably breaking some copyright rules, but I won't worry about that too much. That SAGE handbook on action research that Kim found for us, I have actually added it as a PDF there, which is possibly quite naughty, but I won't, again, until I get told off, I won't worry. So lots of resources from yesterday's discussion. One of the really important points that I wanted to reiterate from yesterday was part of the discussion we had around thinking about the two modules as two discrete entities. So you've got APP 703, which is the module you're undertaking now, which is the project proposal side. They are two completely separate modules. And so you can write a proposal for this module that does not lead you into the project for the next module, but I would argue, and I know most of the students in the group yesterday certainly supported this, is that actually is potentially doubling up on your work, because you need to develop a proposal that's going to lead you into that practice development project. And so as we go through the presentation on ethics this morning, some of the things I will highlight to you as we go along is, if you choose to write a proposal suggesting, for example, interviewing participants that isn't part of your normal everyday day job, then you will require ethics. And if you require ethics, then it is not a service improvement project, and it doesn't necessarily fulfill the auspices of the next module. So you're going to have to, I used the phrase yesterday, and I'm going to use it again quite a bit today, about negotiating a fine line around what is ethical behaviour that is normal for your job, and you behaving ethically and therefore behaving professionally, and those things that are going to require full ethical clearance from an integrated research ethics committee, which is your IRAS. And you do not have time in this particular, or the module that's following, that starts in November, to go through the IRAS process. So if you are trying to develop a proposal that includes that kind of data collection technique, we're going to have to think very, very carefully about it moving forward. It does not mean, of course, that you can't write it up as your proposal. But one of the things that I will write in the feedback, as will Rona, if it's Rona that's marking yours, is this is a sound theoretical proposal, but taking it forward into the substantive professional project, you will need to adjust this. So there's discussions to be had about how you are moving forward and how you're taking this module into the next module. One of the other things that was discussed yesterday was that tutorial time. We do have tutorial time tomorrow. So if either of or any of you wish to contact me, I will be in the office tomorrow. I will be available on the phone sort of in a normal working day tomorrow. So happy to have any kind of discussions with you. But if you want a tutorial either face-to-face or over the phone, please do email me if you haven't already fixed one, and we can look at a time that's convenient to you. I think it's really, really important that we have at least one either face-to-face or phone conversation. So for those of you who weren't with us yesterday, please get in contact regarding tutorial time, and I will follow that up with an interview at the end of today. So all of the material required is, as I said, added to the project proposal tile, and any questions, please don't hesitate to contact me. The focus of this morning's session, though, is going to be around ethics and healthcare research. When you are writing your project proposal, there is a section which is only given 10 marks, but it is a very important section around ethics. And so you will always need to think about, whenever you are undertaking any kind of piece of project work, whether it's a piece of pure research or it's a piece of service improvement in the next module, you will have to think about ethics. So we're going to talk a little bit about what's meant by research ethics, but I'm going to say research/project ethics a lot of the time. I'm going to talk about some of the ethical issues that you will have to think about. Even if you don't have to go to an ethics committee, as I stated before, you do have to behave ethically. And there's some suggested further reading at the end of the session. And as always, this session will be uploaded as soon as we've finished. So what do I mean by research ethics? And I've got a number of definitions and links there for you to click and look at. So the top one, I thought it's quite an interesting one: a broad umbrella covering responsible conduct of research of all its contents, consideration of intellectual property and fabrication. And this is where research ethics and project ethics are very much intertwined, because you're not talking about just purist research, you are talking about any inquiry. So maybe I ought to change the word inquiry ethics instead of research ethics. The subject deals with standards and ethical dilemmas and issues, the rights and wrongs, the values of science and the expected standards of conduct in all. Now, we all are, without exception, I think, on this module, registered nurses. So we all have already a code of conduct that we are expected to adhere to. And there are pieces of the code of conduct which allude to issues such as confidentiality and privacy and dignity and managing information, whether it be verbal or written. So we already have that code of conduct, and obviously everything you are doing, you are adhering to that code of conduct. But there is more possibly to think about when you are doing any kind of inquiry. We've also got quite a few pieces of other guidance that we'll need to refer to. So we've got obviously Universal Declaration of Human Rights, which is something that we're always thinking about. I've got the Data Protection Act there, 1998, but actually the new Data Protection Act came out in 2016, and there are far more rules and regulations about virtual information. So they talk about social media in the Data Protection Act, and they also talk about text and other messaging mediums that we didn't necessarily cover the Data Protection Act in 1998. So there has been an update to that. And they've got very specific rules about who owns information and who has access to it. And this is where, as I've said before, you'll need to think very carefully about what information you are collecting. So, for example, if you work in a particular clinical area where audit material is readily available to you, and you see audit material, so patient statistics, patient demographics, all of that sort of information routinely as part of your work, then you can access that information for your project. But if you are accessing information you do not usually have permissions to access, then you might need additional authority, either given to you by your research and development department. And this is where we'll have to have a conversation, because if you cannot be given authority to look at that information through your research and development department, and you require ethical clearance to look at that information, then that's where the project moves out of a project, the substantive project I'm talking about, and goes into research. And so this is where, although when you're writing the proposal for APP 703, you can include both pieces of information, when we move forward into the next module, you might have to adjust what you are looking at. I hope that's clear. You've obviously got your, as I said, the NMC. We've got ethical guidance from the university about how to practice and how to behave. And there's also other regulations that you will find out there relevant to the information that you are reviewing. So a number of pieces of guidance and information that's available to you. And all of you working in trusts and clinical areas will have your own research and development department, and it will be worthwhile, prior to the start of the module in November, contacting whoever's the lead or link person for your particular clinical area within your trust, and ensuring that they know what study you're about to undertake, and so on. So why do we bother with ethics? Because we are potentially dealing with participants who are vulnerable, and we are also dealing with issues about researcher fallibility. And so the idea is that we are potentially causing harm and distress, which of course we shouldn't be doing. We should be protecting our participants, and we should be protecting the researcher or the student. There is a potential for coercion. And there's an interesting phrase there, which we talk about the moral blindness of the researcher. When discussing your proposal ideas yesterday, there are very specific things that you are looking at, and some of you are looking at issues that might involve other members of your team not doing as they were told, was a phrase that we used a little bit. And that's a very interesting concept to unpick, because if somebody isn't doing as they are told or instructed or advised, is there not a moral obligation by a senior member of staff to correct that behaviour? So by observing it and recording it and perpetuating it, are we not behaving unethically? So we have a obligation as registered nurses to look for poor practice and educate and develop our teams so that poor practice is not something that occurs. So you might argue that by recording and observing people doing something that we perceive to be incorrect, for want of a better expression, that we might be behaving unethically, and that might be something that you'll need to think about. If you're recording any kind of data where something's going wrong or something's not being done correctly, then we should possibly be correcting that behaviour in real time and not allowing it to occur. Now, some of you were citing examples where you'd be recording, retrospectively reviewing audit material that had been already undertaken. And that's fine, because what's already happened, there's nothing you can do about it. But do you not then have an ethical obligation and a moral obligation to do something about it? Now, in terms of your substantive professional project, you are looking at a service improvement. So the whole point there is to identify a problem and to do something about it to improve practice. So that would suggest that you are behaving ethically. That's something that you do need to think about. So when we're talking about ethics, we look at this series of issues or questions, the research problem or the problem that we're identifying as part of our project. So we're asking a specific question. We are using a specific data collection process, a research design, and then we are analysing it and disseminating it. And at all of these stages, we need to have the ethical pixie on our shoulder reminding us, are we behaving ethically? Are we doing the right thing? So we talk about ethical principles of research, but again, I could say ethical principles of any kind of project work or inquiry. If we look at the ones across the top, we've got integrity, competence, non-maleficence, justice, dignity, beneficence, responsibility, honesty, autonomy, privacy, and confidentiality. So all of those issues need to be thought about and potentially addressed in terms of the researcher and the participant. And the participants might be the practice area that we are studying. The participants might be groups of members of staff, they might be groups of patients, and so on. But this is where we need to think very carefully about what we're doing and why we're doing it. So we have a number of normative theories in ethics and research. We talk about duty-based theory. What is my duty? Does this overlap with law? So obviously I can't behave unethically, but equally I can't do anything illegal. Is it rights-based? So what are the rights of the people that I am inquiring about? And what are my rights as the project designer, the project organizer, the project manager? Consequence-based. So what are the consequences of what I am doing? Will there be a benefit? We have to think about, obviously, ethically we can't do any harm, but will there be a net benefit to me doing whatever it is I intend to do? And virtue-based, what ethical qualities, dispositions do I need to be a good healthcare researcher? And I think this crosses over enormously with ideas of qualities that we require for our code of conduct. So we need to be respectful, we need to be honest, we need to have integrity, we need to ourselves and to others. So all of those principles still are in existence. Authors that you might like to look at are Beauchamp and Childress, who talked about the 4 ethical approaches, which are respect, for autonomy, beneficence, non-maleficence and justice. And as I've articulated there, there's a brief definition of what those mean. So my problem, whatever it is that I've identified that's an issue, and we talked yesterday and we've talked before when we talked about developing any kind of project proposal. What is the issue here? What is the thing that I'm looking at that annoys you, irritates you, causes you to stop and think, what's going on here? It's got to be something that interests you, and we talked about that. We've talked about that over the course of the module. So is it significant? If by doing this piece of work, am I going to have a benefit, both to myself? Well, your benefit to yourself, of course, is that you're going to get your master's, but there needs to be an actual benefit to your practice area. Obviously, if you're going for funding, you'll say, is it worth public money? Some of you are having this. Some of you are having this course paid for by your work areas, in which case you might need to have a justification or a business case. Some of you might look to having some funding for the substantive professional project, and that's where this proposal module can be very helpful, because if you can justify the benefit to your trust or clinical area, there may be some money out there for you. So please think about that when you're moving forward to the next module. So is it worth some money? Have you done a thorough literature review to see if other studies exist? So that's an essential part. We talked about that on Friday. Rona talked about that on Friday, and I know I talked about that on Thursday when we were introducing the module and when we were looking at writing the project proposal. It's looking at the literature. There needs to be documentary evidence out there that's published and to support the study that you want to undertake. And is it ethical to repeat the study if it's already been done? Are you confirming what's been proven before, or are you extending, or are you attempting to refute something? And all of those things pose different ethical questions. Confirming something, is that really justified? Extending it is often a very good piece of work, but refuting something can be potentially controversial. So if you're trying to disprove, or you're trying to establish that a particular practice protocol is not working in your particular trust area, what will be the implications of that? So a number of issues to think about: responsibility, competence, non-maleficence and beneficence. So what are the benefits to others of asking this particular question, or identifying this particular problem? So when we get to the research question or project question itself, so this is where we're looking at the project aim. Does it expose the participants to unacceptable risk or invasion of privacy? If at that point, when you're identifying your proposal aim, that you identify that participants will be exposed to potential risk or invasion of privacy, then you absolutely will need to go through ethics. If you're writing your proposal and you are suggesting that you interview staff, and as I said before, and that is not part of your daily job and not part of your responsibilities normally, then you will need ethics. And if you need ethics, then it doesn't fall within the auspices of the substantive professional project. And if you have any questions about that in moving forward, please contact me sooner rather than later, because that is a really, really important thing. And I know yesterday and in a number of emails, people have suggested interviewing members of staff, and I can't. That will almost certainly require ethical clearance. And clearly identify the purpose of the study to the participants, and the participants might be not just particular groups of people or patients or staff, but actually your participants might be your clinical area. So identify the purpose. Why am I doing this? And that should be really clearly articulated in your project aim. What's the purpose? So this proposal will, or this project will, and identify very clearly and articulate very succinctly what it is you are intending to do. So, as that slide sort of demonstrates, so think about your project problem or your particular practice problem and develop your project question or project aim. And then stop and think about it, because there's a number of very specific questions that you need to ask yourselves around ethics. And this is where we will differentiate your project proposal. And we might say that, again, as I've said already, this project proposal is theoretically, a very sound piece of work, but it falls under the auspices of research. So taking it forward into the next module might not be possible. Equally, if you've identified a very specific type of service improvement, then that will be fine moving forward into the second module. And then we talk about the design. So we've identified the aim, we've identified the problem, and we are now deciding what is the best choice of study design. And this is where a lot of thought needs to come into to address what design is out there. So all of those different research designs that we've discussed, either in other research modules in other courses or as part of the research module earlier in your programs. So is the choice of study design an ethical choice? If I'm doing something to a group of people, is it ethical to do it? Now, some of you might suggest implementing an education program to develop practice, and that's completely fine, but you will still need to think about the benefit-risk ratios and the issues around competence and honesty and beneficence and non-maleficence. Is it methodologically sound? And this is where it is absolutely essential that you articulate very clearly your theoretical and methodological basis for your projects. So if you choose to go down the action research route for your study design, which is a very, as we discussed yesterday, a very sound methodology when undertaking a project, a service improvement project, why is that the appropriate choice? Do you have the expertise to do it? If you do, then that's absolutely fine, but do articulate that you do have the expertise to undertake it. But do you need to test it and trial it? i.e., is there going to be any pilot work? And is that pilot work, again, ethical? So you have that little ethical pixie asking you these questions. If you are undertaking or you are suggesting that an education program is implemented in your particular clinical area to, as I said before, develop practice, is it you that's going to be developing this education program? Is it you that's going to be delivering this education program? Or are the people employed in your clinical area around education and development going to do it for you? In which case, what's your workload and management issues surrounding the job that you're asking them to do? Equally, if you're going to do it, are you competent to do so? So possible types of harm: physical harm, obviously, psychological, social, economic and legal harm. So which goes back again to the questions about if you're talking to a group of professionals who are not doing what they're meant to do, by suggesting that they've done something wrong, are you going to cause them some level of emotional or psychological harm? If you suggest that a group of professionals aren't behaving in an appropriate manner, might that have implications to their own personal, professional lives? Is there going to be a legal implications to you identifying that there's a piece of poor practice? I'm hoping not. I'm hoping that these questions will very easily be answered, but it is important when you're designing any kind of project, that you ask yourselves these questions. Is there going to be an economic impact to you asking these questions? So just keep these issues in mind. Are you looking at a vulnerable population? And if at any point you are looking at a vulnerable population, such as children, minors, neonates, for example, minority groups, people who do not have capacity, so people who are you are assessing under the Mental Capacity Act, obviously prisoners or individuals with AIDS, for example. Any kind of intervention with a vulnerable population is going to require ethics. So if at any point you are involving these types of people in your inquiry, in your project design, ethics is going to, full ethical clearance is going to be required. So think about who you are asking and what you're asking them. So you're thinking about issues around justice and dignity and autonomy. Informed consent. And informed consent is an issue across every area, in every project and in every piece of inquiry, research or not. And this is informed consent about you and the inquiry itself. Who are the researchers and their contact information? Who's sponsoring it and what's the purpose of this? So if you are undertaking a study in your ward, you need to publicise that you are doing so. If you are undertaking a study in your clinical environment, it might be that you need to put information to all your members of staff. You might need to put a poster on your bulletin board and so on. People need to be aware if they are the subject of any level of inquiry. I think most members of the NHS staff, whatever their role, doctors, nurses, allied health professionals, are all expecting a level of inquiry. We're sort of used to it. That doesn't mean that they shouldn't be adequately informed. If you are monitoring behaviour and monitoring standards of care delivery, they need to be aware that you are. And there's issues around competence and capability questions that you might need to ask. So again, going back to that, why people aren't doing as they're told. Is there a lack of understanding? Is there a lack of education? Is there an impact to patient care? Is there a reason, a rationale for that not occurring in the right way? So again, these are all questions that you need to ask yourself when you are moving forward. And obviously your line managers, as we've articulated before, need to be on board with this particular project or study. So if you're suggesting doing something to your unit or ward, your unit manager will need to know and be fully informed about the study and why you think it's important. So if you are looking at a group of, for example, Band 5 nurses and what they're doing, why are you selecting that group of people to inquire about? How have they been selected? What are the risks and benefits to them? What's the level and type of their involvement? And how do you ensure their confidentiality? And again, it goes back to that thing, and I know I've said it before and I'll keep saying it, but if you are asking a group of Band 5 something that's outside the auspices of your normal job, then you will need ethical clearance. So about the participants. When we're talking about issues around data collection, we need to respect the information that we're given. We need to treat it with confidentiality and privacy, and we need to very clearly monitor it. There will be issues around data collection and data protection that you will need to think about, and you will need to articulate these in your proposal. If you are using audit material that is being undertaken in your trust already, so collecting or analysing for your own purposes information that's collected by the trust, that information is owned by the trust. And you will have to ask permission to manage that information. It doesn't mean you don't have access to it and so on, but what you do with it and how you manage it are very important issues to think about. So, for example, if you are looking at handover notes, for an example, are you allowed to, it's simple things like, are you allowed to take photocopies? If you are allowed to take photocopies, do those photocopies have to stay on trust premises? If they do have to, if they can be taken out of trust, do they have to be kept in a locked box? You know, we've all heard these anecdotal stories of people's notes being found on buses. That is unethical. That's an unethical way to behave. So if you are intending on looking at patient information, staff information that you have access to in your job, are you going to be doing it while on trust premises? In which case, are you able to keep it in a locked office, in a locked drawer, on an encrypted USB stick, and so on? So all of these things you need to think about. How are you going to manage that data information, and how are you going to look after it and ensure that it is kept in an appropriate manner? So it's simple things like, as I've just said, if you're taking photocopies, what are you going to do with those copies? Are you going to keep those copies in a locked filing cabinet, which is fine and that's acceptable, but you need to make sure you state it. If you are collecting information, that information exists. So where are you putting it? Are you saving it onto a encrypted OneDrive in your computer? Again, acceptable, but you need to articulate it. You can't just say in your project proposal, or when it comes to do the real thing, I will collect data. I will access audit data. You need to be very specific about how you're going to access audit data. Is that audit data readily available to you? Most audit data in trusts are password protected. Do you need additional password permissions to access that information? For example, you going to be using information that's accessed through a third party? For example, are you going to your unit administrator and saying, can you give me an example from yesterday, the number of people who had chest drains on the unit over the last month? Do you have permission to have that information? If you do, great. If you don't, how do you get permission for it? And once you've got that information, what are you going to do with it? So you might think to yourself that this is looking at the minutiae of things, but in fact there is quite a lot to think about, and it might be about simply articulating exactly how you're going to go about these things. Okay. So once you've got this data, how are you going to analyse it? What are you going to do with it? How are you going to protect the anonymity of the participants? So if you are collecting information about the performance of a group of members of staff, how are you going to make sure that those particular members of staff will not be able to be identified once you present this audit data? How will you analyse it, and how do you have experience to do so? And how long will you keep this data once you've analysed it? And where will you keep it? So again, it's about thinking through using encrypted OneDrives, encrypted USB sticks, whatever it is, but that protects data. And I know you'll say to me, well, they could be hacked or whatever, but I'm thinking you've got to make reasonable allowances for what you're going to do with the information that you've retrieved. And it's always at the end of your proposal, you have a section which is about recommendations and dissemination and so on. Because once you've done this study and you've done this piece of this project, it is important that you share it. And who are you going to share it with? How are you going to go about presenting it? Will there be a conflict of interest both professionally and financially? And these are things that you might need to think about. And obviously you're going to be behaving in with integrity and with honesty. I've listed a number of things that are issues when we talk about reporting. Obviously, we can't fabricate our data, we can't make it up, we can't falsify it, we can't copy other people's information. We can use audit information that's been either published elsewhere or in terms of trust collected elsewhere, as long as we cite that correctly. So if you are using information that's being collected by your trust already, you need to make it absolutely clear that that's what's happened and how you have used that audit information, and that you've used that audit information with integrity. You haven't manipulated it for your own purposes. I'm sure that none of you would ever contemplate doing that, but it is something that we need to think about. And using other people's work without citing it appropriately is we refer to as plagiarism. And as I said, it's perfectly okay to look at other people's work and use other people's data for the purposes of this project, and you might identify for the purposes of your proposal, but it is always absolutely essential that you cite it correctly. So just some issues to think about: the rights to be included and the rights to be protected. Recruitment, participants, not subjects, consent, confidentiality and anonymity, dissemination. Recompense and compensation shouldn't be an issue at all for you, because you won't be, there shouldn't be any issues around your participants. Data management is, I've underlined it and put it in bold, because it's such an important issue these days, and it's something that we need to think about. And you certainly need to articulate in your proposal and any other issues. But critiquing research, what questions am I asking? So this goes back to looking at your evidence that you're using to support your particular proposal, any possible biases, coercions, any declarations of interest, and impacts on the results. It might be worth articulating and certainly thinking about for the project that you're going to undertake is, what impact is that going to have on me as a professional and as a member of the team? If you're looking at practice and you're looking at a service improvement, is there going to be firstly a financial impact to you in making this improvement, both positive and negative? And is there going to be an impact to your status in terms of in your professional area? That might be positive or negative. I'm sure you can think to yourselves, if I go in and change something in my particular clinical setting, is that going to be well met? Are there facilitators and barriers to this change or service improvement that I am proposing? How are they going to feel? How's that impact going to impact on me as a member of the team? So it's things that you might need to think about carefully. Firstly, when you're developing your proposal, but also when you actually come to do the project, how you're going to communicate these proposals and how you're going to manage yourself and the participants that you are engaging with. I've said a little bit about research ethics here and the role of research ethics committees, which is more relevant if you're doing a piece of research. And ethical approval processes. There's IRAS, the links to IRAS, there's the links to the National Patient Safety Agency, and there's the links to the Research Ethics Committee there. Your proposal, your substantive professional project, will not need to go through IRAS if you write it correctly, but you still might need to just check certain aspects of it with your NHS research and development or local research and development department. Equally, it might be worth having a conversation prior to November with our Faculty of Health and Human Sciences Ethics Department, and the information about the University Ethics Committee is available on that link, just to ensure that what you are proposing is appropriate and fulfills all the criteria that we need it to fulfill. So I've moved quite quickly through this. So as I've said all along, ethics is unavoidable in any kind of healthcare practice and in any kind of healthcare research and in any kind of healthcare inquiry. So any type of project that you are undertaking within healthcare needs to have some ethical considerations too. Being a good researcher, good project manager requires ethical principles and virtues, as well as different knowledge and skills. You are possibly going to have to develop negotiation, communication, project management, time management skills across this process that you possibly and probably already have, but they will need further development. An understanding of ethics and professional codes is absolutely essential for any kind of professional accountability. You are all registered nurses, and your code of conduct is already completely explicit to your work on a daily basis. Can be very challenging, as it says there, so it is very important to come up with a good idea, have a good research or project aim, and we can work together over the next couple of weeks to ensure that that aim is sound and fulfills the criteria. And it's really important to get some different perspectives. So once we've worked at it here at the with myself or Rona, it's then important to take that aim, that project aim, back to your clinical environment, or I'm sure you can all identify a sort of critical friend within your organisation and run it past them, see what they think about it, because obviously they will have far more local insight and local context to support you, but also support the idea that you've come up with. So a number of references there that have been cited throughout or might be useful reading, including that website at the bottom, which is available there. So that is a whistle-stop tour around ethics and ethical behaviour. And obviously that session, the PowerPoint itself, the raw PowerPoint is there under ethical implications, and a recording of this session will be uploaded in due course. So, any questions? And I'll just open your mic. Any questions, Jo?
I don't think so. There's a lot more to think about than I originally thought.
Okay. Some of those questions that I've articulated there you might be able to very quickly answer. But it's still absolutely vital that you ask those questions. So
exactly.
not every question will need an in-depth, 20, 40, 100 word response. It might be, but it's important that you think about them, specifically things around data management, which is becoming such a huge issue with data protection acts and so on.
No, exactly. I think that's the biggest thing that I hadn't thought about. I don't know why I hadn't thought about it, because I've got audit information, I've got readily accessible audit information through work, because it's something that I do constantly, but it's just what I do with that information, where I store it, what I do with it. And I just haven't thought about it.
Yes, and if you have audit information that's readily available to you at work, which most of us do have, but remember that the purposes of that audit information you are changing.
Yeah.
And so who owns that audit information? And it might be your unit manager, and that's fine. But it still means that you need to say to your unit manager, that audit information I'm now going to use for this purpose. Is that okay?
Yeah.
And 9 times out of 10, they're going to say, yeah, it's absolutely fine. But you still need to ask the question. So if you're looking at, for example, in your case, you're looking at how many hypothermic babies come to the unit, that information is readily available, but you've never been using it to develop a project before. So you just need to make sure that you have permissions to do so.
Yeah, and it's also finding out who does own that information.
And it will be your trust research and development department will be able to tell you.
Yeah.
But you need to say that you're going to contact them and you're going to ask their permission. And it's just simply thinking through exactly what information you've got and what you're now going to do with it, and how you're now going to store it, because you're doing something different with it.
Yeah.
So that's important things to think about.
Oh, my life. My list of things to think about is getting bigger and bigger and bigger by the minute.
Oh dear.
It'll get there. It'll be fine. It'll be fine.
It'll be absolutely fine.
Yeah.
Okay, so I am going to stop the recording now and say goodbye. I won't finish the webinar, but I will stop the recording. Just to mention to everybody watching this as a recording, please could they fill in the module evaluation form. The tab is on the site there that's got the little trumpet. There's a number of questions to fill in. It's just a multiple choice. There's some qualitative information at the bottom to be filled in. Please do look at that and maybe make some suggestions. Obviously running this module again later in the year. So what could I do better? What could I do differently? What worked well? What doesn't work so well? Obviously within reason. And yes, so some module feedbacks would be really, really helpful. So if you could just, and there's very few of you, so I'll know whether you have or not. It's anonymous, so I don't know who said what, but I will know by the numbers if you haven't filled it in. And I will send a reminder out prior to submission about module evaluations if they haven't been completed. So I ask you please to fill one in at some point in the near future. So thanks very much for your attention, and please get in touch if there's anything you need to ask.